Hello viewers, welcome back to my channel. In today's video, we will talk about MRCS ENT. I have made detailed videos regarding each step, each aspect of MRCS ENT and even life after passing MRCS ENT. But still some doubts persist, and thank you so much for reaching out to me. I'll be more than happy to fulfill your doubt, to clear out your doubts, to fulfill your expectation that you have from me. And I must tell you that I feel thrilled each time somebody reaches out to me on social media, and I have had multiple instances where people, random strangers, have reached out to me and I have helped them. Why do I help? Because at some point I was the random stranger asking other people for help, and I received help from all corners of the world. And it is not an exaggeration. I met people from Malaysia, not met but was in touch with people from Malaysia. I met someone from Brunei, from Jordan, from Egypt of course, and from different parts of the world. I got help from Americans, especially during the document verification. I got help from someone in Australia during my English language proficiency test. I got help from, of course, the United Kingdom. People in the UK were so friendly. So it was largely a global effort, and I have also made a video regarding that. But I want to address two important aspects. One important challenge that may be the difference between passing and failing in MRCS Part A. How do you tackle that? And I'll also talk about an important issue in MRCS ENT OSCE and how to deal with that. But before we get into it, I want to remind my viewers what is the pattern of MRCS ENT, how to become MRCS ENT. So there are two exams. There is MRCS Part A, where you get 6 attempts. It is a multiple choice question exam consisting of 2 papers, paper 1 and paper 2. Paper 1, 3 hours duration, 180 questions. Paper 2, 2 hours duration, 120 questions. And there is a break of 1 hour between the 2 papers. MRCS Part A can be taken from the comfort of your own home country. Actually, but there are exam centers. You have to go to the center. It's a computer-based exam. MRCS ENT OSCE can only be attempted after passing MRCS Part A, which is largely a general surgery syllabus along with a little bit of anatomy, physiology, microbiology, pathology, and legal and management issues that one only encounters in the United Kingdom. Again, I have made detailed videos regarding how to pass MRCS Part A. MRCS ENT OSCE is again a 2-part exam. There is a computer-based non-manned exam which largely tests the knowledge, and there is an in-person manned exam which largely tests the knowledge as well as clinical skills, how you communicate with patients, how you perform clinical examinations. The manned exam needs to be taken from one of 4 venues in UK and the Republic of Ireland, and I've also made a video regarding how to predict the venue of the manned exam in MRCS ENT OSCE. There is a method to the madness as well. Now let's talk about one important challenge, or the single most important challenge in MRCS Part A, and how you deal with it, and then we will talk about the single most important challenge in my opinion regarding MRCS ENT OSCE and how you can overcome that as well. Let's talk about MRCS Part A first. I feel the single most important challenge when you are thinking of or you have started preparing for MRCS Part A is you might think it is impossible for you. Don't believe that. Why would you harbor these thoughts? I feel the single biggest issue is the cost. MRCS Part A, I think the last time I checked was around £600, 602 pounds if I'm correct. So one does feel the anxiety that if I don't succeed in this exam, I lose out on these £600. But I want you to use that positively. Instead of thinking, oh, this exam is so difficult, if I don't pass it, I'll lose out £600, flip it around. Pay the £600, book the exam, and make sure you don't have to pay that money again. In my opinion, I felt that the single biggest stressor as well as the single biggest motivator was the sheer expensive nature of the exam. Once I booked the exam, I automatically got the impetus to start preparing. So book the exam using your own money, and I'm sure you'll get the impetus. So use that impetus to prepare as much as you can, and I feel that it is the biggest challenge. People stop preparing because they feel they'll not be able to justify spending that much money on booking this exam, but I feel spend the money and then you can definitely make sure that you pass the exam. But the main thing is you need to remember why you are taking the exam. What is the purpose? Are you doing it for this reason or for that reason? Everybody has their own reason. The reason can be as simple as your friend passed the exam and you don't want to be someone who hasn't. That was the reason in my case, to be really honest. But I passed and you will as well. Now let's talk about MRCS ENT OSCE. I feel the single biggest challenge in MRCS ENT OSCE is to find someone to practice with. I have made detailed videos regarding practice with Puspen, and if you want to practice with me, I can be available at a time of mutual convenience. However, I would recommend to find someone who is also appearing in the exam with you, because then your interests are in alignment. You would want to prepare as much as the person you are practicing with. And this can be solved if you join one of the groups on social media like Telegram, or you join a course like Dr. Osama's master course, where you can find people who are actually looking for practice partners. But it does help if you have maybe a spouse or a close friend who is a doctor and who is happy to prepare with you. So just to recap, the biggest issue in MRCS Part A is the cost of the exam, and you can use that very reason or that very issue as a motivator by paying that money yourself and feeling the pinch monetarily and making sure that you use that positively as an impetus to study, so that you don't have to take the exam more than once. For MRCS ENT OSCE, the main stress is finding a practice partner, but you can find it by joining a coaching course or a social media group where people are preparing for MRCS ENT OSCE. And finding a practice partner not only helps you prepare for communication skills station, but also helps you stay upbeat, stay motivated, and sort of creates a routine, because it's important to stay motivated throughout the process. So I hope you liked this video, and if you need any help, feel free to reach out, because I certainly benefited from lots of help on YouTube, and I'll be definitely happy to help you. Thank you for watching this video. Take care, bye-bye, and please don't forget to be awesome.